Here's a comprehensive overview of Amphotericin B, generic name, drug class, brand name. Generic name, Amphotericin B, drug class, poly and antifungal, brand names, Fungizone, Abelset, Ambisome, Amphotec. 2. What is Amphotericin B? Amphotericin B is a powerful antifungal medication used to treat serious, potentially life-threatening fungal infections. It works by binding to ergosterol in fungal cell membranes, disrupting the membrane and causing cell death. 3. Indication. Used to treat systemic fungal infections, e.g. cryptococcus, aspergillosis, histoplasmosis, blastomycosis, candidiasis, fungal meningitis, especially cryptococcal, certain protozoal infections like leishmaniasis, invasive fungal infections in immunocompromised patients, e.g. HIV, cancer, organ transplant. HADA 4. Contraindication. Hypersensitivity to amphotericin B or any formulation component. Caution in patients with renal impairment, electrolyte imbalance, or bone marrow suppression. 5. Before taking this medicine, precautions. Inform your doctor if you have kidney disease, liver disease, heart disease, low potassium or magnesium levels. Inform about all other medications. Monitor renal function, electrolytes, and CBC regularly. May require pre-medication, e.g. antihistamines, acetaminophen, to reduce infusion-related reactions. 6. How to use. Usually given intravenously, IV, in a hospital setting. Lipid formulations, e.g. Ambisome, Abelset, are often preferred for better tolerability. Administer slowly over 2 6 hours to reduce adverse effects. Use a dedicated IV line. 7. Dosing information. Conventional amphotericin B, Fungizone, 0.25 to 1.5 per kilograms per day IV, depending on infection severity and tolerance. Liposomal intragram pump, 3 to 5 kd IV for most fungal infections. Dose varies based on type of infection, formulation used, renal function, and patient's overall condition. 8. Missed dose, overdose. Missed dose, contact your healthcare provider immediately. Do not double dose. Overdose symptoms: severe kidney damage, cardiac arrest, seizures, electrolyte imbalances. Seek emergency medical attention. 9. Stop or avoid taking if you develop signs of severe allergic reaction, e.g. anaphylaxis, severe renal failure or electrolyte imbalance, serious infusion-related reactions, fever, chills, hypotension, respiratory distress, per physician's direction based on lab monitoring. 10. Side effects. Common: fever, chills, shaking, especially during infusion, headache, nausea, vomiting, low potassium, magnesium levels, anemia. Serious: nephrotoxicity, kidney damage, electrolyte disturbances, hypokalemia, hypomagnesemia, hepatotoxicity, hypotension, cardiac arrhythmias, infusion-related reactions, rigors, shortness of breath. 11. Other drugs will affect amphotericin B. Nephrotoxic drugs, e.g. aminoglycosides, cyclosporine, vancomycin, risk of kidney damage, corticosteroids, diuretics, worsen hypokalemia, hypomagnesemia, digoxin, increased toxicity risk if hypokalemia present. Flucytosine may increase toxicity when used concurrently. Azole antifungals, e.g. fluconazole, may antagonize amphotericin B effect. Thank you. Have a nice day.